Thomas. What's going on? How you doing? All right, good.
Deep breath in and out for me.
Dr. Pete Thomas is a pioneer.
I refilled these inhalers for you.
On a mission to save the lives of black men whose life expectancy is 8 years less than the national average. And he's found an innovative strategy to do it.
We're gonna sort of try to really work with your diet.
Okay, what's going on with your leg?
Stop smoking.
It's called Project Brotherhood. Its goal, to treat the whole man. Marcus Murray is Project Brotherhood's co-director.
We take like a public health approach. So health to us is mental, physical, social, economic, and spiritual. If one aspect is off in a man's life, he's not completely healthy.
I really want to know what's wrong with me. What is it? Can it be fixed? Or if it can be fixed, let me know. So now I can adjust my life for that.
Frank Wilson has worked 2 jobs for most of his life, but a heart attack 3 years ago left him disabled and without health insurance. What brought you here today? Because I know this is the first time you've been at this clinic.
Basically, I was just running out of medications and unable to get appointments or treatment anywhere else. I found out about this place, so I came over here.
Wilson tried to see a doctor at his local hospital, but was told there's a 5-month wait. But he needed treatment immediately, so he turned to Project Brotherhood.
Okay, Miss Wilson, so tell me, you're 51 years old. What medical problems do you have?
Heart problems,
You have a history of heart failure.
diabetes, cholesterol issues,
You have a history of gout.
got gout, PAD. I've had stents put in here and in the leg. And then I've had quadruple bypass, whatever they call it.
Did you have a heart attack?
Yes, 2006, December.
Every Thursday, men like Frank Wilson come to Project Brotherhood on Chicago's South Side for conversation, fatherhood classes, food, meditation,
I want you to take your awareness to your third eye.
and free doctor's visits.
Mr. Henderson?
Everything Project Brotherhood offers is free of charge, a much-needed lifeline during these tough economic times. You have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. You take 12 medications.
Yes, I like to work. You know, this immobility it's killing me. Some of those days I actually ask why he keeps letting me wake up in the morning, you know.
Do you seriously think about maybe death is a better option? Seriously.
Yeah, when the pain is there, it's I mean, you can't move, you can't take care of yourself, you know.
A lot of our people didn't have a lot of these diseases early on.
So the people you're trying to serve are usually poor?
Usually poor, usually without health insurance, but we're seeing an increasing amount of men with resources who just are reluctant to access services elsewhere.
Why the reluctance? Dr. Thomas says some black men are afraid of being exploited, a fear caused by history, and the revelation that for 40 years, unsuspecting poor black men were used as medical guinea pigs in the infamous Tuskegee experiments. Between 1932 and 1972, 400 men with syphilis were lied to about their condition. The men suffered terribly from tumors, heart disease, paralysis, blindness, insanity, and many died. Project Brotherhood overcomes this legacy of fear by staffing clinics with doctors, interns, and social workers who are black. Professionals, they say, their patients can relate to. There are 6 black doctors who see patients at Project Brotherhood. Dr. Gerald Cook, Dr. Raymond Nahr, Dr. Thomas Mason, Dr. Larry New, Dr. Glenn Harrison, and Dr. Pete Thomas. And that's remarkable, given that blacks make up less than 5% of this country's physicians. Project Brotherhood persuades reluctant men to see a doctor, and they use unconventional methods.
And then you had the courage to come in and see the doc. I appreciate you.
We know how to get men to the health centers. And it's not by advertising free colonoscopies.
There's community outreach on the streets and at softball games.
So you can come see a doctor for free every Thursday.
But perhaps what's most effective, says Dr. Thomas, is spreading the word through the people black men trust, their barbers.
HIV is preventable.
And you gotta exercise, man.
So why barbershops? Why are they so critical to you?
Well, this is a staple in our community, and so men feel comfortable coming into the shop, and more importantly, they feel comfortable talking about whatever health issues that they may have.
We make an impact in the community, so it was definitely something that I want to see grow to the next level.
Do you sometimes think, how ridiculous is it that we're going to barbershops to rope people in to getting good medical care?
Yeah. I don't think it's ridiculous, because I believe that the regular medical model is designed to rope somebody in. It's not black men. And so Project Brotherhood just happens to use that model and say, no, but black men, you're welcome now. Now this is your clinic.
Some men just want the free haircut offered at the clinic.
Come on in.
Others seek preventive care.
I also wanted to just check for take a STD test also and just make sure everything is kosher, because I haven't been to the hospital in years.
Frank Wilson needs much more.
Frank Wilson?
Right here.
Okay.
2 weeks after his initial visit, Frank Wilson returns for a follow-up.
Why? Your numbers don't look as bad as they would seem, which is a good thing for you.
Wilson's health has improved, and so has his outlook on life.
Health-wise, I feel good. I'm going to school. I'm trying to find a trade that I can sit down and do.
That's our mission, is to push the envelope in terms of telling black men, you can be healthy. You have to be healthy. Our community, our families depend on that.